Hello everyone, my name is Camila Elias, and I am going to be talking about stressors that affected gynecological cancer patients in Puerto Rico during and after Hurricane Maria. Hurricane Maria made landfall in Puerto Rico in 2017 as a Category 4 hurricane. The communities at major risk were the vulnerable communities. We identified environmental stressors that were hurricane related and also interruptions in oncology treatments. It is very important to address that oncology care and disaster management plans should be included. Our objectives are to analyze specific primary and secondary environmental stressors that affected these women during and after Hurricane Maria, and to determine whether these women with gynecological cancer were exposed to environmental stressors and were prone to suffer from negative health outcomes. For the methodology, 271 women were interviewed. They had to be 21 years or more diagnosed with gynecological cancer, and only 195 met all the selection criteria, which was to be diagnosed between September 2016 through September 2018. The addresses were geocoded to create maps, and spatial analysis was done with ArcMap. We also obtained information such as floods and landslides from various geodatabases to also do the maps. The results show that 51.28% of the women were diagnosed before Maria, and 48.72% were diagnosed afterwards. For the geocoding results, 91.14% were automatically matched and 8.86% were tied. On the down left corner, we can see a map of Puerto Rico, and we can see the hurricane eye track. The majority of the participants were living within this eye track. There was a total of 120 women from 195 living within this zone, which is very it is very impacted because of the strong winds of the hurricane. On the right side, we can see a map of landslides, which are located mainly on the central area of Puerto Rico, since the mountains are in that zone. And basically 25 women from the participants suffered from landslides caused by Maria. On the left side, we can see a FEMA flood map that depicts different flood types, and only 35 women were living inside these zones, but 106 women actually suffered from flooding if we get the results from the interview. On the right side, we have a social vulnerability index map, which the red is the highest social vulnerability index. And the women that were exposed to two stressors, such as floods in the inside of the track of the hurricane, only 8 were in the highest SOVI and 25 were in the lowest SOVI. We have to diminish the poor outcomes of extreme weather events caused by climate change on cancer patients so that they can have a better quality of life. Our preliminary results suggest that FEMA flood maps were underestimating the flood risk in Puerto Rico. And the most accurate geospatial information should be provided because we need adaptation strategies to improve the quality of life of vulnerable communities and to better face extreme weather events in the Caribbean. Thank you so much for your attention.